all on a meditation. So we're going to sink right into the meditation, and you'll be able to listen to this on replay or during your actual birth. So let me have you just go ahead and get comfortable wherever you find a meditative spot comfortable, whether that's laying on your side, sitting with a couple pillows underneath your butt in a cross-legged position, resting your hands on your knees, maybe with your pointer finger touching your thumb. I like to do this with some crystals in my hands because we're talking about birth and birth prep, and this is a birth meditation. I like to use rose quartz to meditate when I'm thinking about my birth prep and helping improve my mindset and visualization in preparation for birth. So find your comfortable seat. I'll have wherever that is for you today. Sink into your body. Take a nice deep breath into belly. Letting that air leave your body. As you inhale, you are imagining your diaphragm, the muscle underneath your rib cage, expanding. When the muscle expands underneath your rib cage, it flattens and drops into the belly. With every exhale, it recoils. With that inhale of the diaphragm dropping deep into belly, it is pressing on the top of the uterus, helping facilitate calming of the nervous system, keeping you in check and relaxed, keeping you in that parasympathetic space. Exhaling, letting everything go. Inhaling into belly, exhaling, letting it go. As you inhale and that diaphragm contracts and presses down onto baby, helping push baby down into the pelvis. Exhale, it recoils, but baby stays down in pelvis. Inhale, belly goes out, diaphragm goes down, pressing on top of uterus. That pressing on top of the uterus is helping open up cervix. It's helping these contractions just feel like pressure. Exhaling, letting it go. Keeping that breath flowing. Inhale into belly. Fill up your rib cage, fill up your belly. Exhale, let it go. We're going to drop down to the pelvic floor, specifically your vagina and your anus. I want you to connect there. With every inhale, as the diaphragm drops down into belly, your pelvic floor is opening, your vagina is opening, your anus is opening. And as you exhale, there's a small recoil. Inhale, air comes all the way down into vagina, down into anus, opening, flaring anus open as if you're going to fart. Exhaling, let that natural recoil happen. So with every inhale, the diaphragm is expanding, pressing on uterus. Pelvic floor is opening, helping create an open pathway for the baby to come through. As you're in labor and you're managing these contractions, you can decide how they're going to feel. They can feel like pleasure instead of pain. They can simply just be pleasure. The pleasure and pain receptors in your brain are similar, and you can decide how they're going to feel. You can decide that this sensation is going to be pleasurable or just feel like a deep pressure. You're going to use your breath to help maintain that train of thought. Inhaling into belly. Exhaling, letting it go. Every time you are inhaling, opening diaphragm, your opening vagina, opening pelvic floor. Exhale, let it go. Let's do 5 silent breaths together. Everyone's timing on this is going to be different, as during pregnancy, your vital capacity decreases. You have less room to fill your lungs with air because the baby is simply taking up space in your abdominal cavity. We're going to sink deeper into this meditation. As I'm explaining things, I want you to continue to keep your eyes closed. Continue to feel like you're in a meditative state. Continue to think about diaphragm pressing down on top of uterus, helping cervix open. Breathing into that pattern. Oftentimes, when we feel pain or we want to brace during a contraction, we'll breathe more shallow into our chest. Our shoulders might get tight, our jaw might get tight as we brace for these contractions. I'm challenging you to keep your shoulders relaxed, keep your jaw relaxed, and keep your breath flowing into your belly, down into your pelvis with every contraction, helping keep those contractions that much more productive, because you're using this muscle of the diaphragm to push on the muscle of the uterus, which is going to help baby descend more into the pelvis. It's going to help you evacuate this baby. And it's going to keep you in a parasympathetic response. It's important that you stay in a parasympathetic response during your entire labor. So we're staying here, keeping that breath flowing. We're going to take this visualization a little deeper now, meditation into a visualization. And you're going to keep that breath going. And now we're going to imagine that baby coming through the birth canal. Deep breath in, diaphragm pushes down on top of uterus. Baby is coming through the birth canal. Inhaling, pelvic floor is opening so much. Baby is pushing down, coming through cervix. Exhaling, holding baby in that place, holding pelvic floor open, letting body just relax around that. You're using every breath as a way to facilitate baby dropping deeper into birth canal. You're inhaling and diaphragm is pressing down onto the baby, bringing the baby deeper into the birth canal. Imagine that baby's head coming through the cervix, about to emerge through the pelvic floor, and then exit through the vagina. Inhaling and opening, exhaling and holding baby there. Inhaling and opening, feeling the pressure of the contractions, using the contractions as an assist of pushing baby down into pelvis, keeping cervix open. Breathing into those contractions, knowing that all they simply are is your uterus working hard. Breathing, baby's deep in birth canal now. And we're going to visualize this baby coming out of your pelvis. We're in a relaxed environment, wherever that is for you. You can take this meditation and visualization into even deeper places by imagining your birth setup, exactly where you're birthing this baby, whether that's outside in a forest for you, or whether that is in your bedroom or at a hospital, or maybe it's in your living room or a birth tub. Creating a scenic place for this event to happen. Imagining whatever is peaceful in your brain and eyes. For me, that's the mountain and the oceans, keeping me grounded and connected to Mother Earth, keeping me in a state of relaxation as I prepare to evacuate this baby from my body. Inhaling, keeping baby there. Exhaling, keeping baby there. Inhaling, diaphragm is pushing down onto baby. Exhaling, keeping baby where they are. As we continue this meditation, we're going to talk about the pelvic floor specifically now. If you don't know how to feel your pelvic floor, go ahead and touch your own vulva, or with clean fingers, insert a finger into your vagina and feel what it means to open your vagina. Feel that breath, inhaling and feeling the opening and letting it go. A lot of people can feel that and have more sensation around their anus. So you can think about inhaling and breathing into anus and flaring anus open as if you are farting or having a bowel movement. So we're just continuing that breath pattern of inhaling into belly, opening vagina, exhaling. Let's try to keep vagina and anus open here. We still have this baby in our birth canal, and we are getting ready to push this baby out. And we're going to use our breath to push this baby out. We are inhaling into belly, pushing baby down further, opening vagina, exhaling and letting it go. We are going to begin our pushing sequence here. And this is what should happen when you go to push. And this is what will help reduce your risk of tearing. So you'll inhale, driving that diaphragm all the way down on top of uterus, helping baby push out with just that inhale alone. On the exhale is where you will initiate the push. And that push should feel like you are having a bowel movement. That push to initiate that, you might feel like you want to do a deep growling sensation, like a and that means when you do a deep voice and a deep sound, your glottis is opening, so your throat is opening, and that is going to help your pelvic floor open. If you do a very high-pitched voice, that is going to close your glottis and close your pelvic floor. So we want this to be an opening event. So with our push, we're going to go ahead and inhale. Diaphragm is down on top of uterus, helping during that contraction, that inhale. After you're full of air, you're going to go ahead and bear down as if you're blowing your nose and growling at the same time if you need to. So we're, or, that was a nose blow there, but you can practice both ways. So at the top of the inhale, you can pretend like you're blowing your nose and bearing down with that. At the same time, keeping your glottis open as you do that. We're not breath holding because that's going to increase your risk of tearing. So let's go into this here. A contraction is blessing our body here. We're feeling it. Our uterus is tight, and we're using that breath to go ahead and fill our whole abdominal cavity, which is then that breath alone is working hard to push the baby out. As you exhale, you can go ahead and bear down with that, keeping as the air leaves your body, the baby's still getting forced out. Pelvic floor is opening and lengthening and widening. Your sit bones are flaring. Your tailbone is going backwards. Baby's head is starting to emerge. Take this visualization all the way through. What does your baby's head look like as that baby emerges from your vagina? What does it feel like? Do you touch down and feel the baby's head? Can you be here in this moment and see this before it happens? You're creating a mental map of exactly what you want to happen, so your body knows what to do when the time is right and you are in labor. Your body knows that this is normal and this is healthy. And your body knows that this feeling is just the feeling of simply evacuating a child. You're breathing in and exhaling and letting it go. As we go ahead and finish the final pushes, you can do what's right for your body with every inhale, moving baby deeper through that vagina. With every exhale, keeping baby where it is, staying open, using that breath to push baby out all the way, using those deep voices and growls to help open pelvic floor, open glottis, help push baby through birth canal. Keep that breath pattern going. And go ahead and imagine that baby crying for the first time and you holding that baby in your arms. The more that you can create these mental maps and images for your brain, the better prepared that you will be. The more that you go through this meditative breathing and pelvic floor opening techniques, the more ready you are going to be. As this meditation comes to a close, if you found it very difficult to feel your own pelvic floor opening, or maybe you feel like your hips are tight and your pelvic floor is tight, this would be a great time to get in touch with a pelvic expert physical therapist who can assess your pelvic floor and teach you how to open it. And if those muscles are tight, can help open those muscles for you. And then you can learn those positions of the muscles and be that much more prepared for your birth. Thank you so much for joining me through this meditative experience and through my own journey for my own pregnancy and delivery that I'm going through. As I continue to prep more for my personal birth, I am excited to bring to you more birth prep meditations and more pregnancy podcasts. So thank you for joining with me. And please leave comments in the show notes if you want us to follow and go over anything more specific, or go ahead to reach out to us at bodymotionpt.com. We would love to help get you on your journey to pelvic floor opening and birth preparation today. So thank you so much. Goodbye.